Hi, I'm Dr. Hansen. In this video, I'm going to talk about fever in children. Nearly every child will develop a fever at some point. The challenge for parents is to know when to be concerned. So let's define fever.
Fever is defined as an oral temperature greater than 100 degrees Fahrenheit, an axillary meaning armpit temperature greater than 99 degrees Fahrenheit, an ear meaning tympanic membrane temperature greater than 100.4 degrees Fahrenheit, which is 38 degrees Celsius, and a rectal temperature, which is the most accurate way of obtaining a temperature, which has a cutoff greater than 100.4 degrees Fahrenheit, or 38 degrees Celsius.
So what are the different causes of fever?
Viral and bacterial infections are the most common cause of fever in children, such as colds, ear infections, bronchiolitis, gastroenteritis, and urinary tract infections. Dressing a child who's less than 3 months old in too many clothes or blankets can increase the child's temperature slightly. However, a rectal temperature greater than 101 degrees Fahrenheit or greater is not likely to be related to bundling and should be evaluated. Some childhood immunizations can cause fever. The timing of the fever varies depending upon which vaccination was given.
So how do you measure your child's temperature?
It's not accurate to measure a child's temperature by feeling the child's skin. This is called a tactile temperature, and it's highly dependent upon the temperature of the person who's feeling the child's skin. Temperatures that are measured in the ear or on the forehead are the least accurate, but they can be the first option. Temperatures measured in the armpit are slightly more accurate, and is probably the best initial way to obtain a temperature in an infant who is younger than 3 months of age, or an older child who can't hold the thermometer under his or her tongue. If the armpit temperature is over 99 degrees Fahrenheit, the rectal temperature should be measured. Digital thermometers are inexpensive, widely available, and the most accurate way to measure temperature. A variety of styles are available. Glass thermometers that contain mercury are not recommended due to the potential risks of exposure to mercury, which is toxic if the thermometer is broken. If a digital thermometer is not available, be sure to carefully shake down the glass thermometer before using it. Instructions for disposing of thermometers that contain mercury are available online. Other types of thermometers are available, and this includes plastic strip and pacifier thermometers. However, these are not as accurate as digital thermometers and are therefore not recommended. Ear thermometers are not as accurate as rectal or oral thermometers. If the child's been outside on a cold day, wait 15 minutes before measuring the ear temperature. Ear tubes and ear infections don't affect the accuracy of an ear temperature. To measure temperature accurately in the ear, the parent must pull the child's outer ear backward before inserting the thermometer. Hold the ear probe in the child's ear for about 2 seconds. When it comes to oral temperature, don't measure the temperature in a child's mouth if he or she has consumed hot or cold food or drink in the past 30 minutes. Clean the thermometer with cool water and soap. Rinse it with water. Place the tip of the thermometer under the child's tongue toward the back, and ask the child to hold the thermometer with his or her lips. Keep the lips sealed around the thermometer. A glass thermometer requires about 3 minutes, while most digital thermometers need less than a minute. For armpit temperatures, place the tip of the thermometer in the child's dry armpit. Hold the thermometer in place by holding the child's elbow against the chest for 4 to 5 minutes. For rectal temperatures, the child or infant should lie down on his or her stomach across an adult's lap, and then apply a small amount of petroleum jelly, like Vaseline, to the end of the thermometer. Gently insert the thermometer into the child's anus until the silver tip of the thermometer is not visible. So this will be about 1/4 to 1/2 an inch inside the anus. Hold the thermometer in place. A glass thermometer requires 2 minutes, while most digital thermometers need less than a minute.
So should you treat your child's fever?
There are pros and cons of treating fever. Fever may play a role in fighting infection, but it can also make a child feel uncomfortable. In most cases, a child with fever can be observed and or treated at home. However, it's important for parents to know when a child with a fever needs to be evaluated by a healthcare provider. It's also important to know when the fever should be treated and when it's reasonable to observe the child without treating the fever. Generally speaking, you should seek medical help for your child if they have a fever and a rash, or if they have recurrent fevers for more than 7 days, or if they have oral, rectal, tympanic membrane, or forehead temperature greater than 104 degrees Fahrenheit, which is 40 degrees Celsius, or if they have an axillary temperature greater than 103 degrees Fahrenheit. Also, if they have a febrile seizure. Febrile seizures are convulsions that occur when a child between the age of 6 months and 6 years has a temperature greater than 100.4 degrees Fahrenheit, which is 38 degrees Celsius. Also, children of any age who have a fever and a chronic medical problem like heart disease, lupus, sickle cell anemia, or cancer. Also, if the child is less than 3 months of age, who has a rectal temperature of 100.4 degrees or greater, regardless of how the infant appears. Also, for children who are 3 months to 3 years of age, who have a rectal temperature of greater than 100.4 degrees Fahrenheit for more than 3 days, or who appear ill, like if they're irritable, clingy, or refusing to drink fluids. Also, for children who are aged 3 months to 36 months, who have a rectal temperature of 102 degrees Fahrenheit or greater.
What are the various treatment options for fever?
In most cases, it's not necessary to treat a child's fever. A child older than 3 months who has a rectal temperature less than 102 degrees Fahrenheit and who is otherwise healthy and acting normally does not require treatment for fever. Generally speaking, treatment of fever is recommended if a child has an underlying medical problem, including diseases of the heart, lung, brain, or nervous system. In children who've had febrile seizures in the past, treatment of fever has not been shown to prevent seizures, but is still a reasonable precaution. Treatment of fever may be helpful if the child is uncomfortable, although it's not always necessary.
Well, I hope you enjoyed the video. Feel free to check me out on Facebook and to follow me on Twitter. Also, for more information or for questions, visit AskDrHansen.com.